Good afternoon, North Dakota. Another beautiful day in our great state. Thank you for joining us this afternoon. We appreciate your participation, either live or listening in at a later time, to make sure you keep yourself informed, help protect your family, your community, your businesses, and your neighbors. So thank you for your time today, especially. We've got two guests that we'll have joining us today. Superintendent Baesler will be back and to join us, as she has many times before. Thank you, Superintendent, for being here. And also for the first time from the podium, but been working almost 24 hours a day since he was appointed, our Interim State Health Officer, Dr. Andrew Stahl, will also be here to share a message about a tool that can help us all slow the spread of COVID-19. Again, thanks for your patience this afternoon. Just a few minutes ago, we got off our weekly call. Sometimes it's Monday, sometimes it's Tuesday. I think whatever day we pick, they pick. The White House moved it to today at 2 o'clock. And so we just concluded a meeting with the Vice President Pence, Secretary of Treasury Mnuchin, Dr. Birx, and all of the other White House coronavirus leaders, including Seema Verma and others. And of course, the messages there that, coming from that meeting, which we can talk about throughout this today and perhaps in the Q&A, but with some of the announcements made on the executive orders over the weekend. But clearly the White House continues to take action through the coronavirus task force to provide relief to support American families and American businesses, and working through the executive orders and with the Secretary of Treasury to do that. But the White House, as they stated today, remains very open to negotiations to try to find solutions for a fourth stimulus bill, and again to support what they've been doing all along, which is a federally supported, state-led and locally executed response to this. And again, we appreciate that approach because it allows each state to manage it as best suits the state's particular needs and populations. News from Dr. Birx that came out to this, a lot of it very positive, coming out of across the outbreaks that occurred in the Sun Belt states back near the beginning of July. But death rates are down in our nation, recovery rates are up, and some of that can be attributed to the fact that all states are doing a better job of protecting those that are most vulnerable. So as the average age of the people getting infected goes down, younger people have a better ability, substantially higher survival rate on this. And then also from a healthcare standpoint, the practices around either plasma donation or remdesivir, which again are allowing hospitals to save lives for those that are most ill. So a lot of positive news on that front. Just an observation here in North Dakota, I would say that when things are going great in North Dakota in terms of when we take a look at our numbers here, because if we've got testing numbers up and positivity rate going down and great individual responsibility occurring by the majority of people in our state, then that bodes well for our future. And I would say just like every crisis our country has faced in the past, we will rise up against this one. All of the progress that's going on the vaccine front at record pace in terms of innovation that's occurring is going to have I think a profound and lasting effect on our nation's ability to respond quickly to these kinds of crises in the future. And again, American ingenuity will lead the way, as we'll see once again. And so I'm feeling very optimistic about where this is all going to end, because it always does as our country rises up, meets the challenges, and North Dakotans rise up and meet the challenges in front of them. In terms of what we're watching back here in North Dakota, pretty simple on one slide, and this is a rolling last 7 days. So if you take a look back over the last week, we've got 934 new positive cases, 844 recoveries, which means we've seen an inching up in the active number of confirmed cases around the state. The number of tests completed in the last 7 days is the highest we've reported in a 7-day period at a press briefing, but just under 38,000 tests completed of North Dakotans in North Dakota, and 2.5% positivity rate, which is among the lowest in the nation. And so this is a very great place for us to be. High testing per capita, low positivity rate. You couldn't ask for anything better than that. And of course, the whole reason we were doing this was to protect hospital capacity. 48 people currently hospitalized in North Dakota related, 48 North Dakotans hospitalized related to this COVID-19. When we take a look at the positive rate, the rolling 14-day average, the white line here is North Dakota. We can see that line flattening out. We take a look at Cass County, that's now below the state average, and the one that's above, where we've got the most number of active cases now in Burley-Morton, rising above the state average, but it also is starting to flatten out, which is a positive thing. Again, the 14-day average, in recent days, 2.6 is what the 14-day average, again, which is terrific. Burley and Morton County, that number that is there, that's a 4.1%, which is nearly 1.5 percentage points higher than the state average. And I think on some days, Burley-Morton here in terms of positives versus tests in Burley-Morton have been over 5% on a daily rate. So again, we've got to really continue to pay attention, and that's why we'll have a short update on the Burley-Morton task force. In terms of hospitalization, I covered this already, only 48, but you can see again this has been relatively flat and well within the capability of the hospital systems within our state, so we're in great shape here in terms of hospital capacity. And in terms of long-term care, which we've worked very hard to protect those individuals, this slide again, the blue is active staff, the orange is active residents, and again, thanks to Chris Jones and everybody on the VP3, which is the Vulnerable Population Protection Team, also all the long-term care administrators around the state, just doing an absolutely fantastic work here, where we're really done a great job at opening up, getting visitation going again, but still keeping cases down. And again, I think we're doing more digging into this, but we see some reflection here of where we've got the active staff, of course, translates to those communities and counties where we see more activity. And so again, where we've got community presence and prevalence, it's more likely than a staff might bring that into a resident, or a family member might bring it in. So again, we want to make sure that we're being very careful when visitation occurs. When you are visiting, wear a mask, keep your distance, and protect not only your loved ones, but everybody in those facilities. This also came up today. It's a big focus of the White House task force as well on long-term care, and there is an effort by the end of September. There's a goal to get point-of-care solutions to all skilled nursing facilities in America. There's about 15,000 of those, and so there's an effort there to acquire all of the machines from one manufacturer, half of the production from the other. The federal are doing that under their authorities. So they're buying the point-of-care machines, shipping them to the skilled nursing facilities. They're doing that on a priority basis, but we would expect, again, if they keep on schedule, that all of the skilled nursing facilities by the end of September may have an opportunity to do point-of-care testing. This is where a visitor, family member could come and get tested and find out within the hour if they're able to conduct a visit, and this would really help facilitate visitation. So the federal government stepping up to help efforts like ours in North Dakota, when we appreciate that. When we take a look at the other activity over the last weeks, we also have had some additional deaths, which is always a sad thing to report, but 8 over the last 7 days. A man in their 60s in Griggs County with underlying health conditions, a woman in her 70s from Sioux County with underlying health conditions, a woman in Grand Forks County, underlying health conditions, a man in 80s, McIntosh, with underlying health conditions, a man in his 40s in Benson County with underlying health conditions, a man in his 90s in Burley County with underlying health conditions, a man in their 60s in Richland County with underlying health conditions, and then today a woman in her 70s from Stutzman County with underlying health conditions. And as always, from Lieutenant Governor Sanford and First Lady Catherine, our hearts and prayers go out to all those family and friends who've lost a loved one during this pandemic. In terms of cases that we take a look at from active cases statewide, and the prevalence around the state, early on, this was really concentrated in our metro areas, and now we see it really spreading broadly across the state. There's positively, though, there's good news. We've got 8 counties across the state you see here that have no numbers on the slide. Those are the 8 counties that currently have no active cases of COVID-19. So that is that's positive. But as was reported again on the White House data, which they do by county for the whole nation, and other governors that were speaking on the call today that were called on, including Governor Walz next door in Minnesota, but and Governor DeWine from Ohio. So other states that might, in somebody's book, be considered Midwestern states are also seeing a spread more towards rural areas as well. And again, because there's been very little activity during this whole pandemic, meaning there's been very likely that there was not prior occurrences of the pandemic, there could be a high degree of susceptibility in rural areas. So again, we have to remain vigilant as we see this potential spread. Burley County, as you see here, is the most with 294 cases, which is almost triple our most populous county, Cass County, with 107 cases. Morton County's got an additional 115. So 409 cases. Burley Morton makes up 35% of all the cases in the state, but those 2 counties only account for about 17% of the population. When we take a look at the prevalence, again, you can see here that with lower population but higher rates, that Burley Morton right now, or Burley just even by itself, is about 5 or 6 times more. You're 5 or 6 times more likely to bump into someone here in Burley County versus Cass County if someone has, but hopefully you won't be bumping into anybody because those active cases are all isolating and staying out of public right now. But again, this one of the things we see on the slide, the darker is the higher number of active cases per 10,000 residents. And if we take a look at our tribal nations, whether MHA, Standing Rock, Spirit Lake, or Turtle Mountain, each of those overlap in some cases with counties that are seeing increased prevalence of reports. And so again, we're continuing to work closely with our tribal partners to make sure that we can take care of vulnerable populations in all counties and all locations across the state. The task force, the Burley Mountain Task Force, again, they had kickoff meeting last Friday. They're off to a strong start. And of course, the goal of that effort is to bring Burley Morton's positive rate in line with the state average as quickly as possible, or get it even below that, duplicate the success that occurred with the Red River Valley COVID Task Force in Cass and Clay counties in the eastern part of the state. And again, subcommittees are forming there around the 5 subcommittees: healthcare, testing and contact tracing, educational institutions activities, the 3rd one being underserved populations, the 4th business community, and the 5th public education and awareness. Another activity that they're working on, again, is to make sure that they continue to do testing. When we've got the highest number of actives, we run higher probability that people have come in contact with a positive here. So testing events that are occurring in the next 2 days. Bismarck Burley Public Health, who's been a great partner through this whole event, another free public drive-through event at the Bismarck Event Center from 5 to 7 p.m. on Tuesday. And Custer Health, which includes a number of counties west of here, including Morton County, has testing set up in Mandan from 1 to 3 p.m. on Wednesday at Dakota Speedway. These are both free public drive up or walk up or ride your bike up events. And again, you can find out more information from those local public health units. And if you again have been in contact with someone who's positive, or you've got symptoms, make sure you make it either 5 to 7 p.m. on Tuesday or 1 to 3 on Wednesday. And of course, everyone's got a role to play in helping to slow the spread, and we talk about that in terms of our North Dakota SMART guidelines. But this virus only lives in humans. If it doesn't have a host, it eventually dies out, and it jumps from host to host. And if you can keep it from jumping from host to host, one way to do that is keep 6 feet of distance or more. Wash your hands frequently. Wear a mask when appropriate. We've been stressing this since the very first days, and Dr. Stahl will be up here shortly to share more about that. But again, of course, avoid touching your face and clean and disinfect surfaces. And again, these are all easy, simple, and healthy and cost-effective ways to help us slow the spread in North Dakota. When we slow the spread, we help not only save lives, but we help save livelihoods, because when we slow the spread and keep the virus in check, it helps all of our businesses in our state. Today, we know that we're a state that works hard to take care of each other. That's been part of our nature since the very beginning. And wearing a mask and doing it properly, wearing the right mask, is a way for us to show we care for others in our community. My mask protects you and your mask protects me. Think about this as mutually beneficial. And as I've said before, there's really only one thing to say to someone if you see them wearing a mask, and that's a thank you. And they're a critical tool in the fight against COVID-19 and one of the most powerful weapons we have to slow and prevent the spread of virus. And again, we know that this is going to be important as we head back into K12 settings, head back into higher education settings, where these schools are going to be, in some cases, setting up requirements that there'll be made local decisions and local campus decisions about this. But we want to, again, increase and raise awareness because there's a lot of information and sometimes a lot of misinformation that's floating around about masks. So today we're announcing the Mask Up North Dakota public awareness campaign, again, to try to focus on the facts about masks and how they can be helpful. And here to talk more about the importance of masks and the campaign in general is our Interim State Health Officer, Dr. Andrew Stahl. And as Dr. Stahl gets ready to step up here, I do want to say to him, mention of gratitude. Dr. Stahl is also a member of the North Dakota National Guard, and he was deployed immediately at the beginning of this crisis and worked diligently with our team and with the Unified Command through the early months of this campaign, and then he stepped up into the Interim State Health Officer, and we really appreciate the dedication that he's doing, taking time away from his regular medical duties to both serve in the National Guard and now to serve currently as Interim State Health Officer. So please welcome Dr. Stahl.
Thank you, Governor Burgum. Thank you for having me here today. I wanted to make a statement about masks. Masks are a critical tool in the fight against COVID-19 as one of the most powerful weapons we have. They help slow and stop the spread of the virus, particularly when used in a safe community setting, and especially in situations where social distancing measures may not be able to be maintained. COVID-19 spreads mainly from person to person through respiratory droplets. These are produced when we cough, when we sneeze, or when we talk. These droplets can land on surfaces and also be breathed in by community members that are nearby. We define a close contact as an individual within 6 feet for a period of 15 minutes or more. Masks help us prevent this spread and are one of the most effective and cheapest tools that we have to do so. Wearing a mask will help us protect those around us, to include our vulnerable populations. These are our parents, our grandparents, and elder members of the community. Recently, the CDC published a morbidity and mortality report highlighting cases in Missouri where 2 hairstylists were symptomatically infected, but yet they continued to cut the hair of their clients. They had 139 clients. Those clients also, by and large, wore masks. There was no spread to those clients. Masks are ineffective, or correction, masks are effective, but they're also cheap. They make sense. Take surgeons, for example. When patients are asked if I'm going to have my surgeon wear the mask, almost everybody says yes. It's in order to prevent a surgical site infection. It seems absurd to have the option to do otherwise. COVID-19 in the community and its spread right now is no different than in that particular scenario. To wear a mask effectively, you need to do several things. You should wash your hands before you put on your mask. You should put it over your nose and your mouth and cover it securely against your chin. It should fit snugly against the sides of your face and make sure that you can breathe easily. The CDC does not recommend using a mask with a valve. It is also important to remove your mask safely. Handle your mask by the ear loops and fold the inside corners together. It should then be washed or placed in a bag. As schools start up this fall, I am happy to see that many schools are requiring masks to be worn. Kids are resilient. And just like we teach our children to wear seatbelts, in this particular setting, a mask is really no different. You can be a role model for your children by wearing a mask. Let them pick it out. Recently, I let my son pick out his mask by allowing him to look at various cartoon characters. He chose his mask. He's now starting to learn to wear it. Practice wearing the masks in front of your kids. Masks also are good play toys in this particular instance as children learn about the new normal that masks may be required for us to help better combat this virus. There are people that shouldn't wear masks, however. This includes children under age of 2, those who have breathing difficulty, are unconscious or incapacitated, or in other words, not able to remove their own mask. We're happy to launch up the Mask ND campaign, as Governor Burgum mentioned. I would encourage you to use hashtag MaskUpND and add your Facebook photo to that as well. We've also created a web page that can be used where members of the public can download images and share on social media platforms. The steps we're taking by wearing masks will have a huge impact. It is cheap and effective, and will allow us to preserve our individuals and economies as we move forward. Thank you, Governor Burgum.
Thank you, Dr. Stahl, and Dr. Stahl will be available afterwards for questions. One of the things that he mentioned that I want to emphasize for those that are fiscal conservatives like myself and believe in efficiency in government, again, as they debate in Washington, D.C., a multi-trillion-dollar aid package for our country, due to the pandemic, one of the most cost-effective, one of the least expensive and most effective ways to stop the spread are the things that are absolutely require individual participation. That's 6 feet apart, wash your hands, wear a mask. It's pretty simple, and it's super cost-effective and cheap. So if you're worried about how much the federal government's spending, then you can do your part as well and join us in the Mask Up campaign and help North Dakota continue its great track record as it has through the pandemic. Next up, I want to talk about, again, back on K12, which we head back to school in a few weeks. A lot of exciting things happening. You'll recall on July 14th, Superintendent Baesler and I were here. We released the K12 Smart Restart Guidelines to help North Dakota school districts plan for reopening this fall, so we can have a safe, high quality, and great educational experience for all of our students. These guidelines were developed in collaboration with educational associations, tribal leaders, all kinds of educational stakeholders, and all kinds of folks from the medical profession, including our interim state health officer, Dr. Stahl. The guidelines emphasize local control and decision-making by school boards and administrators in consultation with local public health units based on the guidance from the North Dakota Department of Health, the CDC, and other resources. As we've said all along, with the pandemic, we're entering new territory because we have yet to manage teaching and learning. We've yet to navigate as a state and communities and families when our 121,000 K-12 students are heading back to school at the same time that we've got 45,000 higher education students heading back all into congregate learning settings. Our guidance gives school boards and administrators the information they need to make decisions for the education of children while keeping the safety of their communities in mind. And as part of that, each school board must approve a health and safety plan in consultation with their local public health unit. In addition, schools will work with the local school board to update and get approved by the local school board their distance learning plan, which were initially created last spring. This ensures that local communities are prepared to provide teaching and learning face-to-face, via distance learning, or a hybrid of the two. And again, one of the things we learned when we went to distance learning last spring, some schools ended up following the lead of some of our schools that had already been the most innovative, where we had some schools in our state that were delivering personalized learning to each of their students, because we know that each learner learns differently at a different pace, at a different rate, in a different learning style. And we're really pleased again to have Superintendent Baesler here to announce a new tool that's going to be available across the state for distance learning that will add consistency and simplicity to the process and help us move towards the recognition that every student in our state deserves to be able to participate in personalized learning that adapts to their style. Superintendent Baesler? Thanks for being here again today, and thanks for your leadership across all these important issues.
Thank you, Governor Burgum, and thank you all for being here again and your interest in education, particularly K12 education. Our priority as we work to not only reopen school buildings but reimagine education is to provide a high-quality education to every child, no matter where their learning takes place, while keeping our students, staff, and their families safe. Schools will look different this year, but our commitment to student well-being and high-quality education will never waver. The Department of Public Instruction has been incredibly busy developing an assortment of resources that students, families, educators, and schools can use during the 2021 school year. And I'm pleased to share the announcement of two of those resources today. According to a public survey that we sent out this summer to all educators and citizens in North Dakota on how to use our federal CARES Act money for education, the highest priority in that survey was to provide readily available academic resources and digital learning opportunities to all. As a result, a supplemental precision learning program will be made available to all 120,000 K-12 students, their families, and schools to provide high-quality lessons in math, reading, and writing. One source of frustration in distance learning this spring was the use of different platforms in different classes. This program will help resolve that issue. But most importantly, it will also put each child on their own unique, personalized path for academic success and for a choice-ready life. This tool will also be very useful if in-person learning is ever disrupted in their school again. North Dakota's Work as One philosophy has brought together the governor and I and the North Dakota Center for Distance Education and North Dakota IT's EduTech to reach an agreement with Edmentum to create North Dakota Exact Path that will be available to all learners this fall. All costs of this program will be covered through federal funding from the CARES Act. North Dakota Exact Path is adaptable to each student and meets each student at their current learning level. It provides assessments as they move through the program that show learning progress and makes learning results available for students, families, and schools in ways that they already use and understand. For example, North Dakota Exact Path uses lexile and quantile measures that are used widely in North Dakota schools. It is anticipated that throughout North Dakota, learning will include a mix of in-person, hybrid, and full distance learning this school year. North Dakota Exact Path can be used in each of these scenarios. We believe that this will assist our educators in providing distance learning lessons that can be used when families request that distance learning option for their children. Families are in the best position to know if their children should return to school buildings. It is more important than ever before for schools and families to be working together. The school-to-home connection has been strengthened during this pandemic, and it needs to continue to be robust. North Dakota Exact Path can help. I want to emphasize that no school district or family is required to use North Dakota Exact Path, but these are extraordinary times, and it is important that our federal aid be used to provide supplemental learning supports and academic assistance to all students in North Dakota, regardless of their zip code or learning environment. Public school, private school, tribal school, and homeschool students will have access to North Dakota Exact Path. The survey results identified another priority, and that was to provide more support for special education students and their teachers. So I'm happy to announce today also that we have just declared an intent to award our CARES Act call for innovative programs for special education needs in North Dakota to Minot State University. Minot's proposal is a research-based special education preparation program that addresses special education shortages in North Dakota. MSU's Special Education Shortages CARES Act project is a unique pathway for paraprofessionals currently working to support students with disabilities to obtain a Bachelor's of Science degree in education with a major in special education. We have paraprofessionals who currently work as special education aides throughout our state, but they are not fully certified as teachers. These dedicated people have already shown their ability to work with and their commitment to students who have special needs. The Department of Public Instruction, the Governor's Office, and our state partners are partnering with Minot State University to offer scholarships to these paraprofessionals. This scholarship money will help them earn Bachelor of Science degrees in education with that special education requirement. 9 paraprofessionals are already enrolled in this program this summer, and we are devoting support to pay for 20 more student scholarships. This program will begin to help increase our supply of licensed special education teachers who are trained in distance learning education. I should note that there is a high demand for this opportunity. For the 9 openings for this summer, there were over 70 applications. Our additional support for 20 more scholarships will go a long way. In closing today, I want to acknowledge that while education as we knew it is clearly a victim of the pandemic, but it is also the solution to the longer-term recovery. Education creates the healthcare workers, the entrepreneurs, and the engineers of the future. So I want to thank you all for your continued commitment to K-12 education, to our students, to our teachers on the front lines, and to their families who are supporting them. And I would ask all of you in North Dakota, as we have our educators and family members making thousands of decisions within the next few weeks, decisions that will impact their students, themselves, and their families, that however you choose to pray for them and provide your support, whatever your higher power is, to just remember them, to give them strength and guidance of wisdom as they navigate their way through the next several weeks as we begin to start school, as we implement our new school year, as we reimagine education. Please remember them. Thank you.
Thank you, Superintendent Baesler, and 2 great announcements around personalized learning for all and scholarships for the much in-demand special education distance learners, and loved your challenge and call at the end for all of us to be thinking about everybody involved in the education community in the weeks ahead. So again, thank you for being here. Thanks for your leadership. Next up on topic is economic resiliency grants. These were announced a couple weeks ago. North Dakota Department of Commerce is finalizing the application process for distributing $66.4 million in economic resiliency grants, also known as the ERG grants, or the energy grants, as approved by the Emergency Commission and the legislature's budget section. The applications are scheduled to open online in 2 days, Wednesday, August 12th. The dollars through these grants will be available to private companies operating in North Dakota. They're used for costs associated with the business improvements to reduce the spread of infection and instill consumer confidence in the marketplace. Commerce's ERG grants will be a huge benefit to businesses in making infection control improvements that inspire customers to return to their businesses safely. And again, these grants will be rewarded up to $50,000 per eligible business, up to $100,000 per eligible business with multiple location. They're offered on a first-come, first-served basis. And the first round of applications will be accepted during a window August 12th through the 28th. So again, opening Wednesday, August 12th. Updates will be available at ndresponse.gov through the Economic Resiliency Grant banner at the top. So go to ndresponse.gov on Wednesday and fill out your application. And thanks to Michelle Comer and the whole team at Commerce that have worked to build a whole new IT system to support those applications. So congratulations to that whole team as well. Next up, we do have a executive order today. As you recall, the Department of Transportation launched its Smart Restart effort in May with prioritized services available by appointment, by mail-in, and online, and through drop boxes. And during the COVID emergency, the NDDOT has continued to provide motor vehicle and driver's license services to customers. Back on June 23rd, I had signed an executive order that extended the renewal date for motor vehicle registrations and driver's licenses that expired on or after March 1st, 2020. That was set up because, again, when we, back in March, we had to close some physical locations, making it difficult for some people to renew their licenses. But with the executive order, those licenses were still valid, and they were valid through August 31st. So this executive order today is an update to that executive order, which was signed in March, that waived expiration dates to try to keep people valid during this emergency. However, it's one thing that's clear right now, because we had almost 3 months worth of backlog that came up. Trying to get all of that cleared by August 31st is not going to work from a business process or workforce or consumer satisfaction standpoint, in terms of we're not trying to create any wait times for customers or citizen dissatisfaction. So we got a backlog of 20,650 driver's license renewals and 48,000 motor vehicle registrations that expired during COVID-19. So a big backlog to work our way through, plus all the current business that's back to the levels that it was before. So the executive order that I signed today extends the deadline, but you'll need to pay attention, because rather than just one deadline, the deadlines are phased based on when your license was due. So please note that the deadline for motor vehicle registrations, however, remains August 31st. The executive order today only pertains to driver's license renewals. So motor vehicle registrations, again, you can do those. Majority of those can occur online or by mail, and so you don't need to, if you're unsure about that, go online and check the information on how you can get that done. But today's executive order has to do with driver's license renewals, and citizens with driver's license that expired after March 1 of this year, or a license that will expire before December 31st. So if you're in this 10-month window, please renew your license according to the following schedule. Licenses which expired in March, April, or May must still be renewed by September 30th. So if you were one of those last spring whose license expired. You had until August. Now you have an end of August. Now you have till the end of September to get it renewed. So March, April, and May, September 30th. Licenses which expired in June of this year must be renewed by October 31st. Licenses which expired in July or August, September, October must be renewed by November 30th. And licenses which expired in November and December must be renewed by the end of the year, 12/31, and then we'll be all caught up. North Dakota law enforcement agencies and private sector businesses operating in the state are required to recognize a North Dakota driver's license that expired after March 1st, 2020, or a license that will expire by December 31st as valid based upon the renewal schedule just described. License renewal and vehicle registration service are available by appointment only and can be scheduled through the NDDOT website at dot.nd.gov or by calling 1-855-633-6835. And again, thanks to everyone at NDDOT who's working to get through this huge backlog. Next topic is the daily behavioral health update. We know, and I'm sure everyone has got personal experiences of friends, family members, or coworkers who have had taken an emotional toll and stress due to the effects of the pandemic. And this certainly across the state, we know that it affects employees as well. Poor mental health and stress can negatively affect team members at businesses through job performance or productivity, engagement with work, communication with coworkers, and daily functioning. In a recent survey of North Dakotans, 68% surveyed identified their top concern was increased mental health struggles. Employers have unique ability and responsibility to support the behavioral health of their team members as they navigate this challenging time. Having your team know that you're there to support them can make a world of difference for their physical and behavioral health. The Behavioral Health Division for the North Dakota Department of Human Services has a behavioral health toolkit for employers to help support employee behavioral health. There are several steps you can take to support behavioral health of employees. One, check in with staff frequently. Set an expectation for managers to reach out at least once a week, particularly during this time of remote working. Humans need personal communication and familiar faces in order to remain connected and feel safe. Provide managers with training to help them recognize the signs and symptoms of stress and depression in team members and encourage them to seek help from qualified mental health professionals. Give employees opportunities to participate in decisions about issues that affect job stress. Host seminars or workshops that address stress management techniques like mindfulness, breathing exercises, meditation to help employees reduce their anxiety and stress and improve focus and motivation. Make sure that you're working with your staff to connect them with resources for childcare. Many staff are dealing with both school and childcare closures across the country and may not be aware or have the resources to provide the care for younger children. Work with your employees to establish clear expectations for productivity and communication when working from home. Employees that are new to working from a remote environment may worry about how their work is perceived when they're not being seen. It's important for employees to know that they have their supervisor's trust, to understand what is expected in order to help reduce unnecessary anxiety. And even during a time of crisis, it's important to recognize and engage staff. If you're a leader, make sure that you find time to express your gratitude to your team. Visit behavioralhealth.nd.gov to review Behavioral Health Toolkit. Again, this is a toolkit for employers. If you're an employer out there today, I encourage you, or if you work for someone, encourage your employer to check out behavioralhealth.nd.gov and find the toolkit for employers. Thank you all of our businesses in our state supporting the behavioral health of your employees. Our good news for the day is some very good news. Again, we've talked throughout the pandemic about how North Dakota has been recognized as one of the leaders in terms of how it's managing all the aspects of its approach and response to the pandemic. We've done it with a light touch from government and a strong reliance on individual responsibility. We've been driven by data. We get the data in the room and the ideology out of the room, and we've been focused on facts, not on fear. year. And so it's an honor for the North Dakota Department of Health to be one of only 4 states to be selected by the Center for Disease Control and Prevention, along with Florida, California, and Minnesota. And then a 5th location, the city of Philadelphia, to be part of a pilot project to plan and implement and get ready for the eventual COVID-19 vaccination program. This would be a great benefit to our state to be part of this pilot program. The health department staff will work over the next several months with a multi-agency federal team, including staff from the CDC, the Department of Defense, to prepare and plan for the COVID-19 vaccination delivery and response in North Dakota. North Dakota was selected because of the health department's successful immunization program and of the state's strong partnership with all of our tribal nations. Meetings as part of this special CDC program kick off this week in Bismarck. This is the 3rd time since the pandemic has started that North Dakota has been selected by the CDC for an important partnership project. Thank you to the Department of Health, Disease Control and Immunization staff for all of your work during the pandemic and for helping ensure that North Dakota is a good place once the vaccination is ready for distribution. We'll close out with some gratitude and then we'll move to Q&A. This week has been declared Community Health Center Week in North Dakota and nationally. And today we'd like to share our gratitude with these community health centers, their dedicated staff, and their voluntary board members that they play in the health of more than 40,000 North Dakotans at 21 sites in 19 communities across the state. These community health centers include Northland Community Health Centers, Coal Country Community Health Center, Community Health Services, Inc., Spectra Health, and Family Health Care in Fargo. These health centers are a critical element in the health system in North Dakota, serving rural and urban communities with primary and preventative health care. Through the last several months of the pandemic, health centers have been stepping up in communities across the state, helping provide COVID-19 testing at their sites, along with walk-up or drive-up testing. One example is Family Health Care in Fargo, which has been an integral part of the Red River Valley Task Force in their response to the cases seen in the Fargo-Moorhead area, with a particular focus on vulnerable populations. Health centers have also collaborated with local public health to lead community testing events in smaller communities and have provided awareness and education to support a safe and effective response across the state. More than 1,800 individuals have received COVID-19 testing at CHC sites. In many cases, as they support new Americans and new family members and new citizens to our state, they've also been involved in language translation to help make sure that everyone can understand this pandemic with good information and with the least amount of fear. Throughout the ongoing pandemic, they have also helped to maintain access to behavioral health care services throughout this, especially for patients needing medication-assisted treatment for those that are in recovery and other supports to help maintain sobriety and recovery. So again, nationally and in state of North Dakota, Community Health Care Center Week has been declared. Thank you if you're a board member, a team member, or someone that is working or has worked at one of those health centers. Closing out with a gratitude quote. This is from 79-year-old American Stephen M. Wolf, who says, each one of us can look back upon someone who's made a great difference in our lives, whose wisdom or simple acts of caring made an impression on us. And in all likelihood, it was someone who sought no recognition other than their deed, other than the joy of knowing that by their hand, another's life had been made better. During the time of this pandemic, there's so many opportunities for us as individuals, as neighbors, as family members, as team members at work, to do some simple act of caring that may, in fact, not only leave an impression, but it might change the direction of another person's life. I know as I think back on my life, I think about teachers, I think about coaches, I think about teammates at work. And again, if you're thinking of one of those individuals right now, this would be a great time to take a moment, send them a text, write them an email, write them a handwritten note, and let them know that they made a difference in your life. By spreading that gratitude, we can help keep North Dakota to be on track, not only to be the best state in place to live, work, play, raise a family, but one that's got a great spirit of community, and we have an appreciation and awareness and consciousness about the gratitude and the abundance that we all have here in North Dakota. So thank you for that. Our next week, we've been trying to center around Tuesdays. Today we had to move to Wednesday. Today we had to move to Monday. Next week we're moving to Wednesday. So we'll be back here next Wednesday at 3:30 p.m. In the meantime, remember to keep being North Dakota smart. Thank you all, and now we'll stand for questions, and for others to remember, we've got Superintendent Baesler and Dr. Stahl here. And I think first up was Jeremy, and then Lane after that.
So, Governor, in the past you've said that it's sensible for businesses to mandate masks if they so choose. I'm wondering if you've given any thought to mandating masks in the state capitol or in public buildings where it seems like there's a pretty low degree of mask wearing.
Well, this is up to individual businesses, as you said, Jeremy. It's up to individual school districts and the campuses in higher education, and I think those decisions are again, best made locally. And I know if I was in a consumer business, and many businesses have already done this, thousands and tens of thousands of businesses around the state, if you want to have confidence in customers and you want to bring back, particularly if your business had customers over the age of 65, I would have, if I hadn't done it already, I'd be doing it right now and saying, hey, this is a mask wearing is a good idea. But again, that's up to, it's again in our state, 34 states have put in, at some level, put in mandatory masks. I don't think that's necessary here as a state to do that because again, we're relying on individual responsibility here in our state because it's again, it's not what the government says, it's what people do. But business owners can make make these decisions. As far as state government, a lot of that, there's a group called the Continuity of Government Team, or the COG team, that's been working on all the recommendations around team security in buildings like the Capitol, where we've got multiple agencies and multiple electives. So even within this, we'd want to have, as it probably again in businesses, a good idea to have team input to help design something that works for everyone. We also know there's a lot of businesses that are able to, that have, rather than mask mandates, they have gone to a extended period of time of working from home. And I know there's at least one global tech company I know of that has made the announcement that they're permanently having people working from home, and they're using it as a talent acquisition play. And they're basically saying, if you're talented and you want to work for us, you can work anywhere in the world, and you don't even have to be in these 12 cities around the world anymore. You can be anywhere. So I think there will be some, we talked about how the pandemic will change business models and approaches, and I think some people will use this as an opportunity to acquire more talent and with more flexibility. Team members love flexibility, and so a lot of opportunity for businesses to innovate right now. Lane?
Governor, since our last meeting, the President signed a couple executive orders, and it puts a little pressure on state and local government. Is North Dakota still equipped to handle these new orders?
Well, I think there's the two big ones that we're taking a look at today, Lane, already, and trying to get some clarity around, has to do with the one related to eviction, the other one related to unemployment insurance. The eviction one, I think, is pretty straightforward because this is similar to what was done earlier and really applies to federal, like HUD housing, housing and urban development, or federally backed mortgages, and that's totally within their purview if that's something that the feds want to do, because they're the ones that are doing the financing, and I think that's relatively easy for us to comply with here in the state, or at least support them, because there really isn't a big administrative burden for the state to do that. We responded to that. There was a call for us to do similar at the state level. We responded with the Rent Bridge program. I would remind people that in the Rent Bridge program, there's been $5 million set aside side. I think only about 450,000 of that has been issued so far through our Human Services Department. And again, that we felt was a very smart targeted program to really identify those individuals that may fall out of the bottom of the housing market if for whatever reason. And so we're trying to catch people before they become homeless, because we know that if they do become homeless, particularly now if they had to move into congregate housing, that's puts stress on those services, much more expensive. So the most cost effective we can do for those at the most distressed end of the economic scale is to maintain this housing first strategy. And we've got the resources in place and a program that's working. So on that one, I don't think there is, I'm guessing we'll see another cry for us to do something around evictions, but I would just point people to the Rent Bridge program and say I think we got something that's even more effective that doesn't completely disrupt and disable the entire housing and rental market in the state of North Dakota, which is a big, that real estate chunk is a big chunk of our state economy as well. So the other one with unemployment insurance is a little trickier. I guess that I'm certain I've already heard that some people may challenge the legality of that. It'll be debated in Congress on whether the executive powers of the government or the president allow him to do that. On the call that we just had with the vice president, with Treasury Mnuchin there, he gave some additional clarity. I think as a state, we're still seeking clarity. As was described, it was going to be currently the $600 on top of the state unemployment expired on July 31st. The executive order describes $400, but $300 of it is from the feds and $100 of it is from the state of North Dakota. If the state of North Dakota was quote, required to do that, that could be estimated could be $55 million, somewhere in that range. Depending on the number of claims, when you pay more for unemployment, the more you pay, the more unemployment you get. And so this would be we've already put $410 million, the Coronavirus Relief Fund, into the unemployment fund. And so again, in some ways, this at a time when we know that we have businesses that are trying to hire people. They were trying to hire people in July. It's tough to compete against $28.22 an hour for not working, which is what the North Dakota plus the 600. It appears that from this morning through this afternoon, every governor in every state's asking these questions. If there's a possibility that the $100 that the state is required to pay is incorporated in the unemployment insurance we already have, the traditional payment that we would make, then that becomes much simpler, because then it's not another $50 or $55 million for the state of North Dakota. Then it would be just a question of whether or not we want to accept and administer the $300 per claim. And so that's, if we get clarity around that, then we'll be faced with that decision of whether we would do that. If it does hold up, then that would be retroactive to August 1st. Might still accentuate the problem that for some people, they would be better off on unemployment than working, and we want to encourage people to get back to work to help our businesses get going again, but we'd have to take a hard look at that if there was no state dollars involved. Long answer, but it's early. We're in the early innings of trying to sort through those executive orders, but thanks for the question. I'm going to go Amy and then Jacob.
I have a question about the vaccination pilot program. Is the fact that North Dakota's been selected for that, is that any sort of indication that North Dakotans might be among the first to get a vaccine when it becomes available?
I'm going to venture a guess on that and say no, because I think that the biggest issues that are going to face our country and the world is going to be the distribution of the vaccine. I mean, this will create political, ethical, economic challenges of enormous proportions, and so I'm pleased that the CDC, that we're included on the ground floor to at least think about how you would think about the planning and distribution of that. Certainly, I'm sure that they'll try to have some kind of prioritization, and I would think that given that we know that the complete uneven distribution of risk of COVID-19, that it really preys on people that are older with underlying health conditions. I would guess in our country that any plan for distribution of the vaccine would include the most vulnerable first. But it's going to be, there'll be some big challenges there, but I'm glad that we're selected. As a credit to the Department of Health and its leadership, and we'll have a chance at least to participate in the logistical aspects of how you do that. The other challenge, of course, for the nation and the world is how do you manufacture that many doses? Because once you come up with a vaccine that could be produced, how do you create hundreds of millions or billions of doses? I mean, this is a manufacturing challenge that the world's never undertaken before, and so there'll be another exciting new chapter there. But it'd be good for North Dakota to be on the ground floor of that.
On the CDC Pilot Project, I guess, what does that functionally mean for North Dakotans? I'm a little unclear on that at this point, I guess.
Well, since the initial meetings are starting this week, I'd say we'd have, and we've just been selected, we'll have more to share as we go forward. But again, when you're on that short of a list with 3 other states and 1 city, and then having a team from the DOD and the CDC coming here to begin planning discussions, that's good news for North Dakota that we can talk about it. And again, I think one of the things that one of the reasons why we were selected is because of our strong relationship with the tribal nations, and we'll make sure that they also have a seat at the table when we're talking about this. Jacob, and then online.
Governor, you've talked a lot about the importance of serial testing and whatnot, but in the last little while, that positive cases have been distinguished between those who are unique testers and those who are serial tested. The unique testers have shown a positivity rate somewhere between 4 to 7 times higher than the serial testing. Would you recommend slowing down on serial testing and putting the test towards where it seems the positive cases seem to be?
Well, I think that there's 2 components there, and we will always, always is too strong. It's highly likely that the unique new individuals that get tested will have a higher positivity rate because people that haven't been tested before during this pandemic probably means that if they're getting tested, they're presenting because they don't feel well. They're like, hey, I've been tested, but I was around some people that were positive. Maybe I should get tested. So I think on the demand-driven side, because those are the tests that are more likely delivered in a healthcare setting. Someone comes in, they come to an emergency room, they give them a test, someone reports that. So I think we're going to see higher there. The serial testing is super important because where we're doing that is across this population of the most vulnerable people, and whether that's in prisons or long-term care or healthcare workers. Identifying a healthcare worker who may have tested negative 2 times before, 3 times before, but they work in long-term care, and then you identify them as a positive and can get them out of that environment. I mean, that's life-saving. So I think that it's the serial testing is really showing up in saving lives. So I think that's a smart part of the strategy, and I have a lot of confidence in our team as they've laid out the testing plans and they continue to evolve. Dr. Stahl is here. He's been also involved in thinking through all these strategies. But the one thing I would say that we're working on now, again, mentioned it last week, is as we keep moving forward, it's not just a numbers game of how many tests we can do. That matters, and we're doing as well as any state in the nation right now in terms of tests per capita per day. We're doing a great job, but we've got to improve the quality, which is a test where we get a result back in 48 hours or less is worth more to us than a test we get back, in 5 days. In terms of slowing the spread. And so we've got a team that's worked hard over the weekend. We've been in contact with, key leaders in the industry and others, manufacturers like Thermo Fisher and Abbott, again, to what can we do. We're working at business process improvement in the lab because it's not just from when you put the sample in a machine and get a test result, but it's all of the, getting the samples from around the state to the lab, getting the information back out, and all the IT IT systems, and so we're doing a complete top-to-bottom review of that, of how we can really improve that. And again, there's occasionally someone will say, hey, I waited X number of days. We hear that. We're trying to track down every one of those and find out the circumstances of where those cases are, and make sure that we can get the highest bang for our buck, so to speak, with the most number of tests back within 48 hours. So we've got a quantity and a quality push going on right now. That's really important as we head back into school. We've talked about pool testing in the past, and one of the things that we're also looking at, we think that we're going to be able to do pool testing with maybe 3 samples per, and do that successfully when we're doing the student surveillance stuff this fall. And again, working with the NDSU and UND research labs to try to get those folks in the game as well, and converting some university labs to be able to do surveillance testing for students. So again, lots of positive things happening on the testing front. Going online, and then Dave.
For the superintendent.
Okay, Superintendent Baesler.
Yes. April Baumgarten with the Forum Fargo-Moorhead. Fargo announced today they would do a hybrid of online and in-person education. What is the majority of the state doing for education, and how confident do you feel about being able to teach students safely as we move into the fall?
So just to repeat the question, Fargo announced today that they would be doing a hybrid of online and distance learning education. And then the question was, how confident do I feel, or what are other school districts doing across the state as far as learning and returning to school buildings, and how confident do I feel that they can return to school safely? So I'll take the first question first. So as you can imagine, 175 operating school districts, educating students in a district all the way from the numbers of 13,000 students plus in the Bismarck Public School System, our largest school district, to one of our smaller school districts in Horse Creek, North Dakota, that has 14 students that belong to, I think, a couple family members. And so the variety and diversity of school districts that we have across the state really demonstrates the diversity of needs that we have and the diversity of responses and plans that have been developed. And so at this point in time, I have not heard of a school district in the state of North Dakota that won't be opening up their school buildings to at least some of their students some of the time. So our buildings will be used. As I said, I have not heard of a school district yet that won't be having their students return to our school buildings at least some of the time during the school week. We do have districts like Fargo has just approved where some students will be returning on a Monday, Tuesday, while the half of the cohort or half of the group of students is distance learning on Monday and Tuesday. Everybody's learning on distance learning on Wednesday while they clean the building, and then the groups switch out. So I've heard a lot of that. I've heard a lot where some of our school districts have less than 100 students, K through 12, in one school building. They will certainly be able to ensure distance learning, social distancing, they'll ensure social distancing while they're wearing masks at appropriate times and having deep cleaning in between the uses of their commons areas. And so there's as many school districts as we have across the state. We have the plans. With that being said, I'm very pleased with the plans that we've seen in respect for the way that they were developed. I do know that there have been different degrees of involvement with the required parties that the governor and the health officer and I set out on July 14th. We did require that the health and safety plans and the distance learning plans be developed in collaboration and in consultation with the local public health units, students, families, faculty, and staff. And so the conversations and the comments that I've been getting are people are very pleased with the collaboration, the partnership that is existing and developing actually and growing stronger between our local public health units and our local school districts. So with that being said, I think that is the critical point of how confident I am about our schools being able to return safely. That would be the growing and ongoing relationship that our school districts will need to have with our local public health units as we reopen our schools, and not only just open our schools, but keep our schools open after that initial day. Yes.
Talking to some school districts, they say that they're unsure a lot about the additional federal dollars that might be coming in to help them out and what they'll be allowed to spend that money on. What kind of guidance have you been giving these school districts with only a few weeks before school starts?
Certainly. So actually just visited with several superintendents this morning and a school board member this morning as well as we work their way through. They are doing what they need to do to open their buildings safely and to keep their students and staff safe and their families safe when they go home at night. So as you are all aware, there are 3 different bills that are with the Senate right now. The HEROES Act that was passed in the House in May, the CC Act, which was passed by the Senate Democrats early in June, and then of course the HEALS Act that was presented and introduced by the Senate Republicans. All 3 of those bills have excellent elements. All 3 of those significantly increase the number of dollars that will be dedicated to K-12 education. Working with my colleagues from across the nation, other secretaries of education, state superintendents, commissioners, whatever their title might be in other states, we're very active in working with our federal delegation and the leaders, Senator Alexander, and of course, Majority Leader Mitch McConnell, as we truly make sure that K-12 education is a priority in the next bill that is ever passed. And so I am encouraging our local leaders and school administrators to do what it takes to make sure that their families feel comfortable sending their students in whichever way they feel is suitable for that family. Yes.
I'm not sure if you're familiar with the photo that was taken at North Paulding High School in Georgia this week. Sort of went viral, I guess, of a crowded hallway with lots of students who were not wearing masks at the time. That's sort of turned into a disaster now. There are 9 people there who tested positive for the virus, and they switched to virtual learning temporarily. I'm just wondering if there are any safeguards from that kind of decision-making from your department or the state.
So I think, just to repeat the question, was referencing the photograph that was taken in the Georgia high school and then the subsequent closing of that school district because of the 9 confirmed cases, the photo that went viral. Ask it if there are any safeguards, anything that North Dakota is doing to learn from that. And I'll tell you that every minute of every hour of every day is us gathering information and learning more and gathering more scientific data, working more closely with our Department of Health and CDC as they work. And again, even since the last time that I've been with you at a press conference on July 14th, the ongoing collaboration and partnership with the Department of Health has strengthened and grown even since that time. And so we are continuing to make sure that we are learning from those instances, and we are developing a plan and we are developing a strategy to ensure that when that confirmed case occurs in one of our school buildings, and I'm not going to say if, but I'm going to say when, it will be an anomaly in our state. If you are in a school district that doesn't have a confirmed case this year, you will be an anomaly. That will not be the exception. It will be the rule. And so just going into it with that, the key will be to have that strong partnership and that response available, that when that confirmed case happens, that we have that strong contact tracing procedures and processes in place. Our local administrators are working closely with our local public health. We can identify who might have been a close contact, contain and mitigate the spread, so we can continue the learning of our students with the least amount of disruption. Yes.
Question for you about the North Dakota Exact Path program. I don't feel like I 100% grasp exactly like what this is, what this does. Can you kind of explain that again? And maybe from a student's perspective, is this something that they would be logging into? How does that work?
Yes, and so it is a precision learning tool, and so it's a supplemental tool. So it does not replace the teacher's instruction, and it doesn't replace the full curriculum. But each one of our students in the state of North Dakota that attends our public school system, the state legislature requires that every student have an interim test, is what we call it. Most of our school districts utilize and leverage either NWEA MAP test or what's called a Renaissance STAR test. And so our students have taken that, and that results of those tests in math, reading, and writing is available to each of our public school students. That interim tests lets us know precisely as educators where that student is in their learning in each of those content areas, in each of those subject areas. So Exact Path uses that assessment to determine exactly where that child is in their competencies and proficiencies in their mastery of learning for math, reading, and writing. So utilizing that diagnostic assessment, each student is available to have set forth for them a path of lessons where it's just the right amount. It's not too hard, it's not too easy, but it's introducing new material, allowing them to practice and master different content in each of those subject areas. So each student will be able to work their way through. They'll have access to a guiding teacher because, again, learning doesn't occur in a vacuum. The most significant factor of learning is that relationship. And so, again, it doesn't just set them forth on a computer online, but it does provide the support and structure of a teacher as well. And that teacher could be an assigned teacher from the school. It could be an assigned teacher from our Center for Distance Ed. It could be that that student's grandmother, their aunt, their uncle, their mother, their father, however a family or a school district chooses to utilize this. That student moves through the course, the lesson plan, on their way to mastery of each of the elements. So actually, it can help students that are in third grade, but are actually accomplished at third grade math and are now working on fifth grade math. And conversely, it could be a student that is in the 8th grade and needs to go back and shore up some of their foundational skills in reading that might be more appropriate at 5th grade. So.
Okay, and a question for you about the scholarships that are available for Minot State University. Is there a total dollar amount?
$750,000. I will also say that there is a button on our website to, we did probably anticipate that some people might not know what North Dakota Exact Path was, and so in anticipation of today, we put that information up on our website, so it's under our COVID-19. We're encouraging all school districts, all family members, all students themselves to empower themselves and take a look and see if that might be a solution that will help them master. I do just want to underscore, I've said it before, as our students return to our classrooms, we should really be aware that no child is ahead and no child is behind. They're exactly where they're supposed to be. And we have these people, these heroes in our classroom that we call teachers that will help them get where they need to be. And in North Dakota Exact Path will be a tool for all of them to use to make sure that that learning occurs. Thank you.
Thank you, Superintendent Baesler. Remind those folks here we got time for a few more questions, and Dr. Stahl is still here. Dave, I think we're finally getting to you after. Perfect, yeah, all right, good lead in. Dr. Stahl.
Dr. Stahl, in the early morning task force meeting, there was a lot of discussion about that the spike here is in 20 and 30 somethings. And they talked about special messages for people in that age group. Do you have any thoughts about what that should look like and why the spike in 2030 here?
Right. So I think if we go back all the way to March, in North Dakota, we were very aggressive about protecting our vulnerable patients in North Dakota. That is our long-term care individuals. It is people in correctional facilities. We initiated that. So initially when we had positive tests, a lot of it was in elderly individuals. Now as we've expanded our testing due to increased capabilities, North Dakota is in a very fortunate place. We can test people in long-term care. We can test people going to the emergency rooms. We can test people that have no symptoms at all. One thing that we call sentinel testing or active case finding is the idea that we go out and we try to find these cases that are out there in order to mitigate or prevent further spread. What we know is that with active members of the community, that tends to be individuals that are in their 20s, 30s, and 40s. It's the working group population of North Dakota. They're the ones that are going to be at the higher risk. I suspect that that may be the case. The data is still out there, but I suspect that that's the case.
Do you have any thoughts?
Right. It all goes back to the COVID etiquette. Frequent hand hygiene, wearing a mask, socially distancing. If you can't social distance, masks should really be worn all the time. If we do those things, we would likely have excellent outcomes.
Yes. Dr. Stahl, we've gotten a few messages from viewers saying that they've been notified that there's been some patient, or possibly will be some patients from Bismarck getting moved to Fargo. Was curious if you had heard of any patient movement amongst the hospitals areas in North Dakota.
There may be some based upon capabilities, to my understanding. I have not heard about that occurring with an individual patient at this point in time. However, as hospitals continue to ramp up and take care of the patients that they need to, surgeries still need to be done. Gallbladders need to be taken out, bypasses need to be performed, heart surgeries need to be done. There are capabilities and flexibility that each hospital has to take into consideration, and that's important to do.
Mike Smith with 660 KUYZ in Williston. Every day we get told there are duplicates or out-of-state tests that affect the state's total, but we don't hear about false positives. Are false positives something that comes up often in testing, and does it happen enough to be a concern?
Right. Let's take a step back and actually talk about this test and how it actually is performed. The test that's performed for COVID-19 caused by the SARS-CoV-2 virus is done through the nose, through a nasopharyngeal sample, the mouth through an oropharyngeal sample in most cases. That's what we perform in the state of North Dakota. What that swab does is it actually binds onto saliva and particles of the virus itself, and then that virus is taken to the actual test where it is binding to the genomic structure of the virus. This test is extremely sensitive and specific for this virus genetic structure. That being said, the chances of a false positive actually occurring due to the test itself is extremely rare, fractions of a %. The most cases where we've learned about it was actually through a clerical error, which we then went back and corrected, and we're continuously doing so. We follow up our results on a periodic basis with sequencing of the genomic structure of this virus as a point-in-time check. We have been very successful in doing so and have had excellent results because of it. Our false positive rate is fractions of a %. Governor Burgum, thank you.
Thank you, Dr. Stahl. Okay, quick one.
Do you know the other 3 states that were selected for the CDC Pilot?
I do, and I'm going to go. Minnesota is one, and Florida is one, and California is one, and then the city of Philadelphia was the 5th entity that was included. Amy?
Is there any update that you can provide on how Justice Vanderwall is doing?
I'm not able to do that. We've been asked if there are any questions regarding the former Chief Justice that they referred to the current Chief Justice Jensen, but I would say that again, our hearts and prayers go out to him for a full and speedy recovery. Remarkable individual, remarkable life, and I know that through this whole thing, he was one of the other people that was showing up for work every day at the Capitol. So he's maybe these are some of the first days he's missed work in 62 years or something like that, and that's 62 years of employment, not 62 years of age. It's been I think probably one of the longest serving. I think he is the longest serving state employee by some large measure right now. But we certainly wish him well. We're going to go Lane and then back to Jacob.
Governor, in reference to the Mask Up ND campaign, why did we decide to do this now compared to maybe an earlier date?
Well, I think we've been encouraging masking all along, and we've seen I'd say a mix of responses to that, and it's as we head back into school with all the school kids coming back, with all the higher education kids coming back, with the increase of cases here in Burley-Morton, it seemed like the time to maybe dial up the communication, education around it, because there's also, I think, more misinformation now about masks than there were, and we know all along there's been kind of a politicization of the mask wearing issue, which I view as unfortunate. I think it's about, the virus isn't about politics. This is about empathy. It's about understanding. It's about caring for your neighbors. So I think this is pretty straightforward. But I also think that, again, I think there was a question brought up again when we're talking about students. You have to have a communication campaign, because I'm going to take a wager that most K-12 students are not watching this broadcast. Most university students are not watching this broadcast. So I mean, we got to figure out a different way to reach them. That's just some straight up marketing sense. Okay, going online and then back to Jacob.
Renee Jean with the Williston Herald. Data from the CDC indicates that having a co-infection with another virus, such as influenza, results in a more severe case of coronavirus. Is there any concern about students going back to school in the fall, given that the flu and other viruses are more active at that time?
Well, I think that this is going to be a challenge we'll face when we get into flu season. You know, it's been interesting. People make comparisons to the flu, and you know, I could leave that to all the medical professionals. But I would say that with a lot less, you know, fanfare than we're, you know, having at these press conferences we had here, the state of North Dakota, including myself, you know, every fall has had a flu awareness press conference. I think last year I had the pleasure of getting my flu shot in front of everyone at that conference. Some of you might have been there to see that. But again, it was it's an important topic because, again, the flu is maybe catches a different sensibility about risk because it affects young people. We had a mother last year that was there who's, you know, 2.5-year-old beautiful daughter had died of the flu in just a matter of days, died of the flu. I mean, that's not anything any parent would ever, I mean, it's a horrifying thought as a parent to think about. So again, trying to have people understand how serious that is. We do know that emergency visits go up seasonally, people presenting with flu-like illnesses. And so one of the things that the CDC tracks and one of the things we track in North Dakota is presentation of flu-like symptoms, and separating flu-like symptoms from COVID-like symptoms is going to be important as we assess risk. And that's why, again, having the ability to test for COVID matters, because you know, with the flu, a lot of times people weren't tested because they'd be just like, hey, if you got the flu, you didn't have a flu shot, go home, rest, fluids, you know, try not to infect somebody else. But I think for the medical community this fall, when we've got both COVID and flu-like things coinciding, it's going to be a challenge for school nurses, for emergency rooms, and that's what I'm saying. We're on a marathon, not a sprint, and we're just, you know, still entering this journey. So a lot of uncharted territory ahead of us, but that will be. It's a great question because it's going to be an area of challenge for us to navigate. It is one of the risks. The good news, however, as we said, with K-12 kids, very little risk of mortality from COVID. So are we adding additional health risk? There's additional risk, but I think a risk that's worth taking relative to the cost of not educating students, not having students in a place where they can receive behavioral health and nutritional benefits, as has been said by Dr. Redfield and the CDC. The health risk to students not going to school, there's a risk to that. You have to balance those back and forth. Jacob?
Governor, the recent announcement that the federal government will be pulling back on National Guard deployments and funds for testing and whatnot. National Guard has played a significant role in mass testing sites around the country. Wondering if you've talked to the Vice President about it in your phone call and how you see this affecting North Dakota testing efforts.
Well, we were pleased last week that the White House signed the order to extend the 32F funding, and they extended it with a 75% reimbursement versus 100%. We had anticipated conservatively that they may not do it at all. So through the Emergency Commission, we'd actually put in $21 million of funding, which was approved by the Emergency Commission to support keeping the National Guard going through the end of the year. So actually, because we were expecting 0, we're getting 75%. We're going to have some turnback dollars, most likely from those coronavirus relief funds that we can deploy in another area, and we can use the 25% of those for the match. So it's correct that our National Guard has played an absolutely essential part of this going through this point in time, and they'll continue to play an important role going forward. I think there's actually some debate that it's been approved at 75%, because there are plenty of other states that are pushing for a revision back to 100. So that game of negotiation may not be over either. But even at 75%, we're well positioned to be able to do that match and keep our National Guard in the game going forward. Thank you. Okay, I think this is our last question.
For Dr. Stahl.
Okay, beautiful. I'll come up and make a closing remarks after Dr. Stahl, but this will be the final question. Thank you, Dr. Stahl.
Jump with Hometown Radio Group in Minot. Can you speak to the reliability of point-of-care machines versus state lab testing?
Right. To repeat the question, it really centers around the accuracy of point-of-care tests versus state lab tests. One thing that I would like to speak to is that the point-of-care tests are, in specific cases, refer to two types of tests. It's an antigen test or it is a PCR test. For example, the Abbott ID Now is a PCR test. The Quidel Sofia 2, which we have as well, is an antigen test. They are tests that look at similar things that we do in our state lab. It is a sample that goes through the nose, it is spun around, swabbed, and then ran on this device as a local point of care test. It is near patient care testing. Other samples are done, sent to our state lab as to which we run. There is differences in accuracy of these tests, which I would call sensitivity and specificity. These tests are considered to be presumed positive if there is a positive test. A follow-up test is usually required based upon their emergency use authorization to confirm that it is a positive test. To state that another way, if we had a positive test at our state lab, but then this test was then performed locally and it was negative, it doesn't mean that they're negative. It cannot be used, according to their FDA EUA authorization, as a follow-up test. So to put that into terms, it is very important to state that the standard of care testing, PCR testing, is done at our state lab or at a referral lab, such as at the hospital, for example, that is running it on their platform machines rather than the point-of-care machines.
Thank you, Dr. Stahl. And also, we have a point of clarification that is going to be made by the Superintendent Baesler.
Thank you for indulging me, Governor. And I think it was Amy's question that kind of brought me to this point. I just want to be very clear and make sure that everyone out there knows that the Exact Path North Dakota Exact Path, is eligible to every family for their students. And so let's say that you're in a school district and your school district never goes into distance learning and you have enrolled your child in face-to-face learning. But if you still want to have this available to your child, to some families hire tutors or pay for weekend tutoring, that even if you never are enrolled in a distance learning program and you never go into disruption, but you simply are a family that wants to have your child have the opportunity, your student the opportunity to make sure that they're working through lessons, maybe as extra homework or that reading program that you want, you as a family member can enroll your child in North Dakota Exact Path for this upcoming year. And so it doesn't need to be connected with a school district, it doesn't need to be connected with a distance learning plan, but if any parent or any family member is out there that is interested in having their child engage in North Dakota Exact Path, it is open and available to you, and you can simply contact, we're working with the North Dakota Center for Distance Ed, and you can simply enroll your child in this North Dakota Exact Path to help them and assist them as their own private, specific, precision tutor. Thank you.
Again, thank you, Superintendent, for getting that made available to every student in the state. Thank you. In closing out today, again, a reminder, next Wednesday at 3:30 we'll be back. And in the meantime, I want to thank everybody who is here in person, all of our mask-wearing question askers in the room are doing a great job in the media to help keep the state informed. Thank you for your regular participation. Thank you to Lindsay for another marathon session. What's marathon look like in the...
Marathon.
Okay.
Long time.
Okay. All right. Well, thank you. Thank you, Lindsay. And also, again, thanks to all of our viewers for staying informed. Thanks, Dr. Stahl, for you and your team. Thanks, Superintendent Baesler and all the education leaders that are doing the great work there. And let's keep the good things going in North Dakota, masking up and practicing individual responsibility. And we're going to continue to make our way forward in a very positive way here in our state. So thank you very much. Have a great day.